right. Welcome to the Physio Zone podcast. I am your host, Scott Kaler, and I'm really excited today because we have a special guest that took some time out of their day to come and be on with us. We have Dr. Laurel Lemasters, and she is the owner and founder of Imago MRI. And we're fortunate to have one of her centers here in Greenville, which is actually how we met because we were sending some patients that we needed just a great place to get some good images. And what I really love about what they do at Imago is the communication is top notch. So if I can send somebody and usually get a same day image, the radiologist will call me back and then we can have a conversation about that patient's image, which is really helpful for me to help quarterback their care. And when Laurel and I were talking the first time, getting to know each other on the phone, we got all the way to the end. And I said, "Oh, I wish I would have been recording that for our podcast because it was such a good conversation. We talked for almost an hour. Laurel is just such an awesome person. So you guys are going to love this episode. So without further ado, I'm going to bring Laurel Lemasters into our conversation here. Hi, Laurel. How's it going?
Howdy, how are you?
Thank you for being here with us today. Really excited to have this conversation.
I'm so happy to be here. What an honor. Yeah.
So, you have a great background in medicine. A fun fact for our local listeners is I forgot that you did your undergraduate at Furman University here in Greenville. And so you were familiar with the upstate beyond just your business being here, but you spent some time as a college student.
Actually, Scott, it's before that. I actually
Okay.
moved to Greenville when I was about 10.
Oh, wow.
I carry my little bit of my Chicago accent with me, but I'm a Southern girl. We moved to Greenville when I was about 10, went to middle school, and went to Wade Hampton High School in Greenville. So
Nice.
I really am a Greenville girl. And then my husband and I are both paladins. So we met at Furman and graduated together. And so starting this business off in Greenville made sense. This is home
Oh,
for us.
oh, that's great. And then after you worked for a little bit and you went to medical school at the University of Miami. That's correct.
That's right. Yeah.
And then you started your route is pretty interesting because you pursued being a surgeon, made it through 3 years of the program, and then transitioned over into radiology. So you have the unique experience of spending quite a bit of time in the OR as well as doing radiology. Do you want to speak to some of that before we get rolling here?
Well, honestly, some people might say it was a detour. I think it's part of what makes me a good clinician. You know, surgery is a 5-year program. And the first 2 years, you learn how to be a doctor and how to take care of people. And then starting in the third year, you learn how to actually operate. I was training at the University of Miami, which is very heavy trauma. So I got a trauma degree, is what I always say, which means my kids didn't get much attention unless they had audible bleeding. But I love surgery. It met a lot of my needs. I loved the rapid pace, the sort of intellectual stimulus of having to find out something right away and be able to act on it. I ended up having my first child in my third year of general surgery. I was the first person that they'd ever had married, much less have a child. And I realized that was not really how I wanted to go about life. Being a mother was important. You know, we're here the day after Mother's Day. Being a mother is still my number one job. And I have 4 adult children, now even grandchildren. So I'm very excited about being a mother. And I didn't want to compromise. Now, of course, every working mother is going to say, of course, there's compromise. But I did find a great option in after having matched in surgery and doing a surgical program that I was able to get a place at University of Miami in the radiology program, which is a 4-year program. And then there was a natural inclination for me to do a little bit more interventional. They knew I had hands. So I did a lot of interventional radiology, both then and then in my first private practice job, which is at the Emory Healthcare in Atlanta, St. Joseph's Hospital.
Gotcha. Oh, that's great. So, what was the draw? Because you had so many options in your path. What made you be excited about going into radiology?
Honest engine, Scott. There was not much excitement about going into
Okay.
radiology. A surgeon is a surgeon. And I think forever in my mind, I think of myself as a surgeon. It's kind of like the worst thing a surgeon could be would be an anesthesiologist on the other side of the table, or a radiologist, or worse even that, a pathologist. But they are parts of the medical practice that allow you to have a little bit more work-life balance. And so I chose it, honestly, not because it looked so exciting, because it looked like I could be a mother and be a doctor and be, I didn't want to be a mediocre doctor. I wanted to do it to the highest of standards. And I did find that although radiology residency was not a walk in the park, it was something I could see my kids occasionally go to bed at night. So it was a good thing. I had a child and then I had twins right afterwards. So it was a crazy, chaotic time, and I wouldn't trade it for anything. But I love that I had a great clinical experience. I know what clinicians want to hear, especially a surgeon, and I know to cater to them. But then I also love working with patients, and I think a lot of radiologists, frankly, don't like patients. They
Mm.
want to sit in a dark room and read their scans and not be bothered. And I am a little bit of an anomaly, and I surround myself with people like that actually like patients. Radiology does give us the same rapid problem solving. It's kind of like being a detective or a puzzle maker of finding out you have a symptom, I have some images, how do I put them together so that you can go get better? So I have found I've loved what I do, but I don't think I was smart enough to have chosen it. God was just good.
Yeah, well, it certainly comes through. I know on my end, when I get y'all's reports, I like reading your reports because it puts it in language that both the patient and I can understand very easily, but still it's very easy for the surgeon and applicable for the surgeon to read. So I think you guys do a great job on that front. And I love it when I get a radiology report from Imago because I'm just going, okay, I can talk through this with the patient and help quarterback their care. So I would say you've lived up to your goal on that front.
Oh, I'm so glad. Well, the whole idea of our model is that it's all about the patient. Everything else you see is all about the system. And I never want to degrade what's out there. But we've all experienced it. And I've been in that world for so long that the idea of having Imago was finally to be able to do this in a way that made me feel really good at the end of the day. That this is patient-centric model. We're doing a self-referral, which means you don't have to have a doctor to send you. Self-pay, which means you actually know what you're going to pay. It's all outlined. Many times a much more affordable option than going through insurance. But so it's all about the patient being the one to be in charge. And so in the end, what our product is that time at our center with our staff. So that has to be pleasant. And then what you get at the end of a report and images has to be to the highest standard. And for a lot of people, they have an ache or a pain. They want to know what's wrong. I have to speak to them. But in the end, I have to have a report that they can take to the surgeon, to an orthopedic surgeon, to a neurosurgeon, to the primary care, to their physical therapist. So they have to have an American College of Radiology correct all the bells and whistles that would be needed in a hospital-based radiology report. And all of our radiologists are board certified. We all have specialty boarding. And then, but like you said, what we try to add on to that is here's your report for your doctor. Then here's what it means, and try to put it in layman's terms. And then I'm very excited that we try to say, now what do you do with this information? Because a lot of people are choosing to do this because they don't know if I have a problem with my shoulder. Is it worth seeing the doctor? I'm not sure. So our whole idea is, well, just take a look. We're visual people. Look at it and see. And then you can decide, is this something I can go back to Scott and he can work with me and help me get that? Or is this something I need to completely rest for? Or am I going to tell you, hey, you got to go see a shoulder surgeon? But that's what we're trying to get to. What are the next steps you do? So you have a little bit more of a radiology review, but also a little clinical know-how.
Yeah. Oh, that's awesome. So what are some of the most common orthopedic conditions that you guys are seeing at your center?
Well, lo and behold, the United States does not do well with back pain. Everyone has had back pain if they're over 30. And the current medical system with insurance has a lot of barriers to entry. So for you to know what's wrong with your back, someone else tells you when you can know. Usually you have to go see your primary care gatekeeper, then you get to a specialist. Usually insurance makes you wait 6 weeks to do physical therapy and sometimes some pain medication. And you really sometimes still don't know what's wrong. And what we're trying to offer people is, you hurt your back, you get to know. Nobody's stopping you to know what's wrong with your back. And I think it's first of all, it's much more affordable. You miss a lot of appointments. You get right to the heart of the matter. Is this something that I'm going to need to do 6 weeks of physical therapy in? Okay, maybe I'm not going to go on opioids for 3 months and get hooked. Maybe I this is when I have to go see a surgeon right now, and now I have imaging to show him that I need surgery. You, it does make things go faster. I think it gives people peace of mind as well. So back pain is the big thing. You have an acute episode of back pain. If you've ever had that, you know to have great empathy for anyone who's ever had it. You know, you're laying down, you can't move, you feel like an idiot. I can't get up to go to the bathroom. I can't drink a straw. There's so much stuff. And so back pain, I think we're making a huge dent in people getting to be in charge of their own healthcare. I get to see what's wrong with my back, and no one can gatekeep me. I actually have a partner who's a Duke trained neuroradiologist who is just fabulous. Has worked for spine centers for a bunch of people, so works for spine surgeons and is highly regarded. And he does all our spine imaging. So we do a lot of, I think it's our number one scan is a lumbar spine. I have a musculoskeletal or sports
Hmm.
specialty, so I love knees and shoulders because that's where it's at. That's back to that again. You know, I watch people on the street. My kids make fun of me that I'll watch somebody go, "Oh, they don't have an ACL on that left." You know, you can sort of tell what's wrong with people just by their look. And I think, you know, somebody has a bum knee, they get to look and see. Do I have a meniscus tear that needs to be surgerized? You know, like you can actually keep from having arthritis later in life if you get it taken care of. Or is this something you need a patellar band and you need to strengthen your VMO and, you know, have a good therapist help you? The whole idea of just take a look and see, you get to know. So knees, I love shoulders. I mean, I tell people, friends in my age group, that the number one thing I've seen that just shocked me was reasons to get a rotator cuff is, I don't know if you can see me, but this mechanism is a mother shushing her kids in the back
Yep.
carrying a rotator cuff. So, I mean, shoulders are another source of problem. And, you know, it's a very different treatment from a rotator cuff and a labral tear or a bursitis. So why not know? So those are two that are common. I love them because it can change the course of somebody's, whether they're going to get arthritis or whether they're going to get healed right away. We had a fun case the other day that was a physician, a foot and ankle physician, who was out, I think, on the trampoline with his kids, with
Mm.
his young kids, felt the pop. He knew, oh dear, what have I done? He came to our center, didn't even make an appointment, dropped in, got his ankle scan to confirm a big Achilles tear with a big gap, and had surgery on Monday morning. That is eliminating some steps.
That's
He
right.
just knew that he didn't have to go through the rigmarole. He could come and just get some imaging.
Yeah,
So that's what we love doing.
yeah. Well, I love that, and you just hit our biggest three diagnoses that come through our door. So it's patients with low back pain, shoulder pain, knee pain, and then it's a close, fourth for either hip or foot, ankle. It just depends on the week on that front. But yeah, what I am pushing for, and it sounds very similar to what you're pushing for as well, is that the patient can drive their care and they're at the center of it. And we're trying to cut out all the unnecessary steps that they have to go through. And so if someone has acute onset back pain that started, or even if it's been chronic, I don't, either way, but
Mm-hmm.
then not having to go through the primary care doctor's office, who then is going to send them either to a specialist or to the physical therapist, all of which take weeks, if not months. And then they plus or minus some imaging. It's like, hey, I would love physical therapist to be the gatekeeper.
No.
Let's decide if I need to send you on for some imaging. Probably for another episode, we could get into how do we know if that image that we see is the cause of the pain or not? And I think my little sneak peek would be it's a piece to the puzzle, and we want to acknowledge it and not ignore it and just sweep it under the rug. But it is a piece of their story for sure. Um, but if I can help change somebody's symptoms in the clinic, especially in that first or second visit, we're probably good to continue with that conservative care. And if they're not responding to a good bout of physical therapy relatively quickly, I want to get them to see you guys sooner rather than later. Would you agree or want to add anything to that?
I love that. One of the things that I've found in Greenville, in this community, seems to be very health conscious. And there is a lot more of the direct care model everywhere, either with concierge physicians or preventative health or functional medicine. And the physical therapists, because of this model in South Carolina, are allowed to sort of be the caretakers. And my view is physical therapists are one of the few people that touch the patient and actually do a good exam. Now, I'm not throwing, stone at anybody, but nowadays in a medical practice, you get about 7 minutes with the patient.
Mm,
And most doctors aren't working for themselves. They're working for someone else that's giving them time frames and basically outcomes that they have to do. So the chance to get a good exam is actually, the physical therapist is gold. And that's why we've really tried to partner with physical therapists, because that's enough to send a patient to say, my physical therapist says I should get an elbow. Um, we're trying to really hard when patients come in. Our job is to make sure they're getting the right kind of scan, because they're usually not getting a referral from a doctor. So although we take those, but if they come in and they just tell us what's wrong with them, we've got a lot of training to be able to help them to say, I know you say you're hurting in the upper arm, but we're actually going to do an elbow because I'm worried about your biceps tendon. So that's on me to make sure we do the right imaging for you. But you have to be the one to come and say, this is what I'm thinking. This is what my physical therapist told me. This is what my chiropractor told me. I do think that people are taking enough of their own health in their own mind that this is a way for them to take a look themselves.
yeah, for sure. Um, yeah, I love what you guys are doing on that front there. So if someone decides to come and they to get an image with you, what does that process look like for that patient from the time they come to the imaging center to determining their next best step? So kind of like how quickly will they get their results? How does your team help them triage whether they need a surgeon or conservative care? And then is there anything else that you'd like to add to that process?
Well, our goal in our model is this self referral, self pay, nothing hidden. So you get online to imagomri.com. You choose your appointment time that you want. You choose the scan you want. And then most of the time you can come same day, next day. So very fast. The whole idea is affordable and fast. And then we want to get your results fast. So you come to our imaging center. We have wonderful people working there, but we've really carefully chosen to make sure that people are anxious free, that they have one where they're treated with respect and dignity. We've all been to the place where you come and it looks like you're bothering them. That's not where we are. That you're coming, we want you to come, and then we're going to do safety checks to make sure that nothing is going to go wrong. If you need somebody to sit in the room with you, we'll do that. We're trying to make this where you don't have to be anxious. We take on the part of the taking care of you, and then you just come. We come, we do the scan. You walk out of that center with a CD. That a lot of doctors want to do the old CD way. So we do that for the physicians that require that. But within sometimes 12 hours, usually we guarantee 24-hour turnaround, you are going to get an email that has the report in it itself and all the images in a link with a passcode, which you can forward to your doctor, to your physical therapist, to a friend, to another radiologist friend of yours. So you have those images with you all the time. The CD thing, I mean, we're honoring that because there's a lot of physicians that don't want to let go of that. But the honest truth of it is, when you have your images in the cloud, you own them and can share them as
Mhm.
necessary. So we love the technology of we're trying to be, online appointments, online, we give you a report online, and we do that within 24 hours. So we even have an option where you can say, I need this result same day. So the whole idea is affordable, self-pay, self-refer scans that the process is easy. Now, when you get the report, there's actually, we give people an option. Do you need to talk to me about it? I can give you a consult. And again, back to that, I've told you, I like patience. So we can do a consult where we go over the findings. We provide imaging, little snapshot images. So you don't even have to look at all the images. The patient can see an image with an arrow and a highlight that says, here's your meniscus tear. So then they can say, what does this mean? What does it mean, chondrosis? Or what does this mean? Now, hopefully not left them with words like that. But to be able to say, this is where our particular cartilage has frayed or become very thin. So we can explain it, try to talk about what the next steps are, and hopefully eliminate fear. I think medicine has become a fearful place and an expensive place. And that's what we're trying to do, is to not let it be fearful.
Yeah.
You know, one of the other things, Scott, that we have not talked about is that we are doing screening exams at Imago MRI as well. So for people who, you know, it's not really a knee, it's not, what if your mom had ovarian cancer and every time you feel a little twinge in your pelvis, you're thinking, oh my goodness, maybe I have ovarian cancer. We do screening exams.
That's
So
good to
you can
know.
come and do a chest, abdomen, and pelvis. So like the whole trunk to look for cancer. Now, a lot of people, they'll say, well, I don't really have any symptoms. I'm just fearful. That's a symptom. And we're so grateful to be able to offer this where let's do a screening. Look, here's both ovaries that are normal. Go in peace. I just love the idea that we can find things that are early and hopefully something you can work on, or we can give you peace of mind to know you don't have something. We had a wonderful patient. Actually, this was in the last 5 days. Somebody had a feeling in her neck. She kept saying, I think I have something on my neck. There's something swollen. And went to the doctor and they said, no, your thyroid's normal and there's nothing, I don't feel anything. And she kept pursuing it. And, you know, sometimes people, you know, get treated like they're cuckoo with their doctor because she kept saying, no, I feel something. Check my thyroid labs again. Do everything. Well, she found that she had come and looked at her abdomen and pelvis with us as a screen. And when I talked to her in our consult, she kept telling me about this neck thing. I said, take a look, get a neck exam, not a cervical spine, like a soft tissue neck.
Yep.
Do you know that this woman who was being treated like she was kooky had a 1.5 centimeter lesion in her oropharynx? So every time she was swallowing, she probably was feeling this mass. This is how you treat squamous cell carcinoma when it's small. She just saved her life by looking when she kept saying, I think there's something wrong. Yep. And she hadn't been given the time of day. So I'm so grateful that we're doing that kind of work too.
Yeah.
Letting people trust their own gut.
Wow. Yeah. I always tell patients when they ask me, what do I think? I'm like, well, you know your body better than anybody else because you've been the owner of it for your entire life.
That's so good.
And so if you have a gut intuition that something's going on, let's get to the bottom of it. Let's figure it out. And I'm going to help guide you. But your job's to give me feedback because I might need to refer you to someone like yourself or to another provider. So I love that. I hate that was the outcome of the image, but I love that you caught it early and that she kept being the best advocate for herself in that example.
Honestly, she was so happy, Scott. I mean, she knew something was wrong. And I think sometimes when people say, I told you, it was like,
right.
She wasn't actually worried about the outcome. I think she knew the next steps. But she was so happy to say, I knew there was something wrong. So, yeah.
Yeah. And going back to something we were talking about earlier, that one of the reasons that we set up our clinic the way that we did was so that we could have those intentional times to not feel rushed by the clock. And so like if you send someone our way, we are spending an hour with that individual. And so we get a full health history and it's always the most fun because we'll ask some questions and they'll try to just like spit it all out real quickly because they think I'm about to like leave the room. And I'm like holding my coffee and just like legs crossed. I'm like, no, I'm here with you. What else you got? And they go, okay. And then they just like keep going and they share some more and then they finish. And I'm like, okay, what else? And then they go, okay. And then we can get to the real issue of it. And so that's why we've been intentional with just trying to create that amount of time so that we can get to those layers, make sure that patient's been heard. And then that way, whatever decision we're helping them make, we're making it with the most information at our disposal that we possibly can. So I think that's where our
kudos to
oh,
you,
thanks.
man. I mean, it's so beautiful to hear. I think there are so many of us that want to do this right. We've chosen at Imago, we chose a high-end state-of-the-art scanner, a 3 Tesla. So that's why the images are so beautiful and they go pretty fast, a lot faster than, so, you know, a lot of people don't like the MRI idea, but we do have a very fast scanner, but we give people a long appointment time because we don't want to hurry them. I've played that game. I know what that looks like. You know, I've got a thing and somebody else is coming right behind you and I actually double book. And, you know, no, we actually, if the patient says, oh, you know what, I actually have to go to the bathroom. Okay. We have time. We're not going to hurry people and we're not going to say, quick, you got to get out of the changing room for the next patient. We're personally trying to make this about you, and we're going to give you what you need. And the response to it, people can tell the difference. It feels
That's right.
good. Feels good.
One question that I've been meaning to ask you and I forgot. In your center, do you all have an open MRI, or is it for some of our patients that feel like they're gonna be too claustrophobic?
Well, I want to welcome them. How about that? We are for
Okay.
everybody. It is
Okay.
not an open MRI scanner.
Okay.
There's a trade-off always in everything. I'm always trying
Sure.
to tell people, please do the risk-benefit analysis of
That's right.
everything. So on open scanner, usually that's for people who are either highly claustrophobic or who are bigger and can't fit in the round tube of the MRI. The images are not as high quality and they take longer.
That's right.
So you're going to end up, especially somebody with back pain, you're going to lay on this table for a long time. And so there's a place for it. And I read for those for a long time. So I'm not against them. It's not what we chose to do. We wanted to do high quality, do it fast, and get people in and out. Now,
I
the
love it.
key to this to work is the right technologist. And our MRI technologists have been around enough to know all the tricks and how to get people to feel okay. We obviously they can listen to music while they're doing a music of their choice. They have things where the scanners open on both ends, so we can actually have somebody see through to the other. A lot of the times we can choose whether to put the patient in head first or foot first. So if it's a study that you don't need to be all the way in, we'll turn the patient around so they don't have to actually be in the scanner. Obviously, a head has to go. If you have a headache and you want to look at your brain, it's a good thing to do, and you're going to go in the scanner. We're just going to do it fast, and we're going to help you. We can do it with eye coverings. We use cucumber oil. There's a lot of tricks to help people with their breathing patterns, but we have all the people who know how to do it. So we'll take care of you. If you come and you're afraid, you come and we'll try.
No,
Yeah,
that's
yeah.
great, and I hope people hear that because it's worth going there and getting the images because they are very high quality images that you guys do. Oh, that's great. You've already told two really cool stories of patients that have come, the surgeon with the ankle pain after the trampoline accident, and then the lady that was the thyroid issue. Give us another example of a patient that just makes you so excited that you started Imago. I love these stories.
I got a couple come to mind. Okay, Saturday night we had a college athlete come, and she wanted to get a knee because she was hurting, and she had a foot worried about a plantar plate injury. Immediately found out she had ongoing Osgood-Schlatter's disease, which, if you don't know, that's just where the patellar tendon, that's the tendon that puts the kneecap down into the shin bone, it was inflamed. And it's one of those where it doesn't require surgery, but she can do things with a physical therapist to make that better for her trainer on the team. And knowledge is king. She now knows she doesn't have an ACL tear. She doesn't have all the things that a college soccer player is worried about. There's some relief, and she has a plan now. So I'm very excited that we can meet those needs and timely. I mean, obviously, she wanted to know if she could play the next time. We had a kid recently who was throwing athlete, which I think you should appreciate,
Yep.
and he had shoulder pain, and of course we did a study. He had a humeral epiphysitis, or little leaguer shoulder, and rest is the key to that, right? I mean, kid was probably throwing too much or not doing it when his not letting the throw count be monitored very carefully or whatever. But I think there's things like that we can help people with. One of my favorite stories was when we were starting out right after Hurricane Helene. We were down for a while, and we were having to test all our protocols again to make sure everything was working well. And so we had friends of the family, friends of the staff coming in to do some scans to test. And one of our staff people had said, I have a friend, he's this young, healthy guy with a bunch of little kids, but he thinks he has cancer. And so I was like, oh, bring him in, like we'll do a full screening of him and we'll find out. Well, lo and behold, he was riddled with cancer. Young guy had no idea except that he had a lot of pain. He had rib lesions, back lesions, sacral lesions, where he ended up having multiple myeloma. He's actually in treatment. I talk to him every week. He tells me what he's doing. But he was sitting on the fact that he was hurting so bad, and he thought there was something wrong with him. He thought he was just getting lazy to take care of his kids, and I hurt so bad, and I don't know. He didn't want to go further with it, but he had a fear underneath it. And you know what? We found stuff. He was able to right away get treatment, and now he's my friend, which is wonderful too. But um, I do think that fear is one of the big things we take. We're going to put some billboards up in Greenville about trying to tell people about Imago, and I think we're trying to say, do you have an injury? Let's see, is it injury, pain, or fear, or concern, or worry? And I do think that the screening exams can help with that. But even like an orthopedic thing, I'm fearful I hurt my ACL. Fear is no fun. And I do think that we're providing an affordable way for people to live in peace.
Yeah, those are some great examples, and the underlying theme on all of those is the patient either knew what was wrong in the case of a trauma or had the fear that you're talking about, but it was their intuition, it was their understanding of their body, and they had an outlet to be able to go and seek the knowledge that they needed to make the next best decision. So
Yeah.
I look forward to seeing those billboards. You need to put one up near our office. That'd be great because our offices are not that far apart.
Yeah.
No, that's cool. So I appreciate all the patient stories and just what you've been able to describe of what you guys do for every patient that comes in the door. What would be something you would want, or a couple of things you'd want everyone to know about Imago? What's the thing when people hear the word Imago MRI, what do you want them to think?
Ooh, I like the way you worded that. I think I would want people to say that place is for me. Like that's my place. That they treat me well. I know what's coming. There's no hidden costs. I get what I ask for, and they treat me well. Back to what they treat me well. Um, it's for everybody, even people who are afraid of MRIs. We can handle you too. Like you don't have to be embarrassed about that. A lot of people are afraid of MRIs. I'm always telling people when they say, "Oh, I want to do a screening, I'll just do CT screening." I'm like, "Oh, there's radiation. There's MRI doesn't hurt you." And I think that's one of the things especially for screening exams. Back to that risk benefit. You don't want to add radiation while you're just checking something. So MRI is a foolproof. We're not getting contrast either. So we're doing non-contrast studies. So there's no downside to doing a screening exam. So I just would say we're for everybody. We can figure it out with you.
Oh, that's great. Well, you've mentioned the 3T weighted magnets that you guys
Mm-hmm.
use. Are there any recent advancements in diagnostic technologies that you want to share with our listeners?
Well, our goal is to just do standard imaging better than other people. So diagnostic imaging, there's enough for everybody. So we're not competing with other people in Greenville. The hospitals have a 3 and 4 week wait. We're not competing with them. We're taking the stuff that people say, well, no, I really want this right now. So we're not competing. I think we're trying to do what diagnostic imaging does really well. We're doing the highest end with the scanner, with our people, with our protocols. Our radiologists do regular continuing medical education, so we're always up to date on the newest thing. Stroke imaging, we're doing some really cool things. I always tell patient stories. We had a patient, this was early on, who came in with a headache and some odd symptoms, and she just didn't want to talk about it much. She brought her mother in. She was an adult, but brought her mother in, put her on the scanner. She was having an acute stroke. My technologist was so fabulous. She said, look at this immediately. We looked at it, and we sent her immediately to the emergency room with a scan, with her MRI scan. So, I mean, there's things like that we know, like the newest things to be doing, diffusion imaging in the brain. We're doing stroke screening for the vessels of the neck. We're doing aneurysm screening in the brain. We have actually a little package that we're offering, which is all the vascular. So the neck and the brain together. You get it done once. You're in there once. You don't even know that they're doing two studies. We're doing for a little private place. We're doing some academic work with the Mayo Clinic. They're doing a study using our facility. They wanted only high-end scanners, so we're doing like a brain dementia study. So people come and they're doing that. So I think we've been honored to know that we can produce very good images. So we're keeping up with the academic world in that way. But our main focus is just to do the right thing every time.
Oh, that's great. That gives me some possible referral sources for you too. I just met a great neuro doc here in town that you might be a good fit to talk to. I
Yeah,
think
it's
it's
kind of fun, Scott. A lot of these, I have to say, one of our biggest clients base are
that's
doctors.
great.
Even doctors working at these large facilities, because they're like, oh, yeah, I could get a scan, but I'd have to wait for my insurance to clear it. I'd have to wait for Prisma to open a slot. I'd have to, no, I'll just come to you. So honestly, we've had a, a lot of docs who understand the benefit of it. And then through that, they're willing to say to people, well, you could go to this scanner, or you can go over here and get it done fast. And it's actually much more affordable. So I think that's where we're getting a lot of patients based on those doctor referrals.
Oh, yeah. Well, any last parting things that you think would be helpful for someone considering getting an MRI at Imago?
Yeah, I would say please visit our website, imagomri.com. And I think if people have a hard time with the word, I want them to think Imago Dei, the image in the image of God. So that's where the Imago parts, that's the image of God. So imagomri.com. Our website is, I think, really inviting to let you sort of scroll through what options are available. Pricing is all upfront, so you know exactly what you're getting into. And I would say have your people look at our socials, post on our socials what you like about us, what you want us to do better, especially people outside of Greenville. If you're interested in this and you say, please come here, we'd love to hear that. We're in the expansion mode. We'd love to think of what other markets are needing this the most. Um, I think it's probably every major city and even where there's academic centers, this is where it gets hard to get a regular scan. So we are looking, and I'd love to hear people on the socials. We're very interested in that.
I love it. Well, Dr. Laurel Lemasters, thank you so much for being on our podcast. And I can't wait to hear the feedback that we get. And just again, thank you so much for being here.
Glad to partner with you, Scott. It's a delight, only a delight. Thank you.
All right. Well, thanks so much. And we'll talk to you here soon.